Hey guys, you made it to the final exam. This is your final exam review blueprint. It's going to be similar to the midterm review. I'll give you some page numbers. I'll give you some pointers on kind of what to focus in on. So it's going to be 100 questions, multiple choice. You'll have 2 hours to complete the exam. So good luck. All right, let's get started on this review. I've tried to be nice to you because this is a lot of content and you only have a week to research and accumulate this blueprint and study it before the final exam. So you'll notice on the Word document, not on this PowerPoint, but on your Word document, I try to put the page numbers where you're going to find this content. Don't hold me responsible if I may have gotten the wrong number, page number. You can shoot me a text or something if you just can't find something. But this is just to kind of help you out because you have a lot of content to cover in a short time. So let's get started. Now, if you took the midterm, a couple of you didn't make it to the midterm and you're going to have to make that up after the final exam. But if you took the midterm, you will have noticed that the questions that you had, you looked at all the answers. All the terms are here for you to define. So I'm going to show you on the next slide, but you have to, before you go to the next slide, define apoptosis, define ischemia, hypertrophy, necrosis. Those four you need to define because there's going to be a question, and I'm going to show you on the next slide. Pathogenesis. This is simple definitions, guys. This is recall. This is the very basic level of understanding and education, period, in any class, and even nursing classes. Recall is just the very, very basic level, and you have to be able to get through that point to make it through this class and then to build on to go into a nursing program anywhere. So look up these definitions. We're going to talk about those here on the next slide. Look up the medical history. This is going to be a select all that applies question, so you can't just go, well, I think we would probably need someone's weight. Well, look up the medical history and tell me and answer all of the questions as far as all the things that would be included when you're taking a medical history. Look up primary and secondary and tertiary prevention. That I did put a page number there, but I didn't for most of them. Let's go to the next slide. All right, I told you I'd give you an example. So this isn't actually a question off of your test. So I expect every one of you 100% to get this question correct. A deficit of oxygen in the cells, usually due to respiratory or circulatory problems, is called. All right, if you don't know what that is and you don't know what all these terms are, then it's going to be a guessing game, right? So let's look at the terms. Let's look at the first one, apoptosis. This is programmed cell death. It's normal self-destruction by digesting themselves. And they become like vesicles. We call them I can't say it. They're that word, apoptic bodies. Since the normal cell's components are reduced, they're quickly engulfed through phagocytosis without causing inflammation or the inflammatory response. So, the deficit of oxygen in the cells usually due to problems? No, because we said this was normal. Let's look at ischemia. Decreased oxygenated blood to tissue or organs due to circulatory obstruction. Does that look like what the question asked? It definitely does. Let's go a little farther though. Give me some examples of ischemia. Think about when someone has an MI, a myocardial infarction. The blood supply to the heart is obstructed by a clot. That part of the heart muscle, excuse me, will become ischemic, and that's where the typical pain originates when someone is having an MI. Their pain is very severe because of that ischemia. So that is the answer, but we're not going to stop there, are we? We're going to go on to hypertrophy. What does hypertrophy mean? Hyper is over, right? So that's going to be an overgrowth of tissue. This is a deficit of oxygen. No, we know it's not that. We know it's not that. Necrosis, let's look at what is the definition for that? Okay, that's the death of one or more cells or a portion of tissue or organ that is irreversible damage, and it's not a programmed cell death. Okay, it doesn't say anything about respiratory circulatory problems with necrosis. So we're going to say no, that's not that. It is ischemia. So those are the four, and that's how your questions are going to work. That's why if you do this blueprint and look up every single term, then you will have answered every single question on your test. There are 100 questions. So think about how lengthy this is going to be. 100 questions have usually 4 options. That's 400 terms that you're going to have to look up. If you know the term, don't worry about looking it up. But if you don't, you need to look them up. The term pathogenesis, that's a whole different question. So development of the disease or the sequence of events involved in the tissue changes related to a specific disease process. Think about it as the way the patho causes the disease at the cellular level. Like the lining of the vessels may be affected in some vascular diseases. So when you look at these terms, you need to know the textbook term, but put it in your own words so that you can actually recall that textbook definition and you can understand what it actually is talking about. Okay, so if you'll notice, I also organized these questions in this blueprint according to chapter. Again, I'm trying to make it easy on you. And again, sometimes the page numbers are here, sometimes they're not. So hypo or hypernatremia. First, you got to know what is natremia. You just got to remember that that is salt, Na+. Sorry, I can't draw well with this pencil. Okay, so you have to know what is it. What are the lab values? What's the norms? And how are serum levels affected? So let's look at sodium. Something that you're going to be doing in your nursing program, wherever you go, is you're going to be describing the different labs, what they are. Well, you got to go back to your A&P. Sodium is the primary cation, which is a positively charged ion in the extracellular fluid. It moves by diffusion between the vasculature and the interstitial fluids. There's actually a pump that helps this to happen. We find sodium in our mucus and other body secretions. We lose it by way of perspiration, urine, and feces. The kidneys control the levels, but the importance is that it maintains extracellular fluid volume, and it also conducts nerve and muscle impulses. So your normal value is 135 to 145. Your textbook says 135 to 142. It's not that much different. You don't have to know that difference there. Just know, put in your mind that it's 135 to 145 and keep that. So also I wanted you to look in the back of your book. There were some really, really good lab values there, like they're all compared. Just look at the very back page of your book. So now that we know what sodium is, let's look at hyponatremia. Hypo is less than, hyper is more than, right? So hypo would be less than what? We said it was 135 to 145. Hypo is going to be less than 135. Causes, usually direct loss from the body, or excess water is put into the extracellular compartment, causing a dilution, excessive sweating, vomiting, or diarrhea. Some drugs, diuretics like Lasix, some hormonal imbalances, chronic renal failure, those kind of things. So some of the effects, since we know sodium is related to nerve and muscle conduction, then we see fatigue, muscle cramps, abdominal cramps, nausea and vomiting. These shifts of fluid result in what we call hypovolemia, which is decreased volume of fluid in the body and a decreased blood pressure. Ultimately, the brain can swell. Then you would see the confusion, headaches, weakness, and seizures. That's what I want you to look for when you're doing these hypos and hypers. Let's look at hypernatremia real quick. Hyper would be more, so it's more than 145. Causes: ingestion of large amounts of sodium without proportionate water intake, or if you're losing it faster than you can replace it. Again, vomiting, that kind of thing. Look on page 23. There's a table 2.5, and this is all in one place. If you're a visual learner, you will appreciate how they're set up side by side. And start trying to do some of your stuff like that. It really is helpful when you go to test. All right. Specific causes for excess sodium. ADH insufficiency, diabetes insipidus is one of the examples. There's the loss of thirst mechanism. There's watery diarrhea, prolonged periods of rapid respiration. Because remember, we lose it in these sensible and insensible methods of fluid loss. So the effects, the fluid shifts out of the cells due to increased osmotic pressure. So we then see weakness, agitation. You'll see firm subcutaneous tissue. What that means is that the edema related to the excess fluid in that tissue, and you can just feel the skin is kind of tight. You're going to have thirst, dry, rough mucous membranes, and decreased urine output. So what you have to do is you have to learn the function of these labs. Just get them down now, and it'll be much easier for you that first semester of nursing school. Get your normal values. What causes hypo or hyper in whatever you're studying. It's going to help tremendously. So now you guys go and look at your kalemia, which is hypokalemia is your potassium. Potassium. Do the same thing for that. Kalemia, calcium. And then look to see how the serum pH is controlled. All right, chapter 4 is pretty self-explanatory. Look up chronic, neuropathic, central, neurogenic, referred, phantom, ischemic, and cancer-related pain. Compare and contrast those to see what's the difference. Sometimes that's the way you kind of figure out what the right answer is, that maybe with chronic pain and phantom pain and ischemic pain, and you have some of the same symptoms, pick out the things that are different. And those are the ones that you need to commit to memory. All right, let's talk about chapter 5, granulation tissue. You need to describe that. You need to know that the healing process starts when the injury occurs and a blood clot forms. It seals the area, and then inflammation occurs surrounding that injury. In 3 to 4 days, there's phagocytosis and macrophages that clean that up. Then granulation tissue grows into that gap from nearby connective tissue. Granulation tissue is very vascular and moist and pink or red. It has new capillaries and is very, very fragile. So don't pick off scabs. That's something that you're kind of putting yourself back to square one. So sometimes it's tempting, but don't do it. Inflammatory process. What causes it? Why do we have the signs and symptoms that we see? What are the signs and symptoms? What are the events immediately after tissue injury in regards to the inflammatory process? This may be I have to put this in order question. So you need to make yourself some brief little notes on, well, first this would happen, then second, then third, and that kind of thing. Look up the word pyrogens. What are they and what do they do? How do they do what they do? Lots of what's and who's and how's, huh? Okay. Let's move on to chapter 6. So let's take a look at the question that we had on the previous slide before we move on. What are the events immediately after tissue injury in regards to the inflammatory response? So I've pretty much given you the steps here, but I need you to look at them a little closer and decide what they are for sure. What is hyperemia? What does it mean? What are you going to see when someone has hyperemia? What does increased permeability mean? And why is that a thing? What are leukocytes and what does their migration to the area, what does it do to the skin? So just knowing the steps isn't enough. You kind of need to go, okay, what does this mean? What is vasoconstriction? Transient means off and on, not consistent, not all the time. Vasoconstriction is the vessels are constricted. So take a look at the different events, but also describe them well. All right, chapter 6. More terms for you. Bacteriostatic, bactericidal, antiseptic, and disinfectant. It's pretty much a recall question. You got to know all of them to know which one's correct. Okay, so what occurs when the tissue is inflamed? Or we could say, let me look here. Mm, what is more likely to happen to tissue that is inflamed in some way? You have to think about the primary purpose of the skin. It's a barrier, right? If we have inflammation, if we have injury, if there's a break in the skin, it's going to be more prone to infection because it's not doing its job properly. Look at influenza. Look at the complications. Look at the patho of how the flu. We're fixing to be up on flu season. Why do people die just because they get a virus? Take a look at it. Pay special attention to how there's necrosis of that respiratory mucosa, and just really understand how getting the flu can sometimes be fatal. All right, we're moving on to chapter 7. Let's take a look at primary versus secondary immune response. I want you to compare those. Primary, pretty much what it sounds like. It's your first exposure. You have to be exposed to something in order to produce antibodies or sensitize T lymphocytes against it. It usually takes a week or two. We can actually test serum for antibody titers. Secondary is going to be recent exposure to the same antigen. Even if years later, memory cells can produce large numbers of matching antibodies or T cells. Young children are at risk once they enter daycare until they finally produce antibodies against so many of the infections that they face. But due to mutations, like with the flu, that's why our flu shot doesn't always work, even if we get it, because they can't, they kind of guesstimate, but it can mutate so quickly that it's just impossible to completely desensitize someone to it. So I'm going to put a couple of YouTubes on your Canvas under modules, probably wherever you find this review. And it has some explanations. I like this guy, I can't remember his name. I've got several of his YouTubes up there. And he explains some of these hypersensitivity reactions. And they're pretty short and he's pretty interesting. So let's take a look at type 1 hypersensitivity. Examples, it can be as mild as hay fever, but it could also be severe, like food allergies that cause anaphylaxis. Here's how type 1 allergic reactions happen. Number 1, you have to be exposed to the allergen. Number 2, IgE antibodies develop from B lymphocytes. These antibodies attach to the mast cells. These are now called sensitized mast cells. These mast cells live in connective tissue like the respiratory and digestive tract, and that's why we see the symptoms that we do in anaphylaxis, the itching throat, they feel like their throat's closing because the respiratory and a lot of times digestive upset as well, because that's where this is happening at. Now, unless there is re-exposure, nothing's going to happen. But most of the time we go back to that chemical, that plant, that drug, that food. So we get re-exposed to that same allergen, and that allergen attaches to the IgE antibody on the mast cell, and there's where we have this chemical reaction. Histamine is released. It causes vasodilation, inflammation, increased capillary permeability at the site. That's why you get nasal stuffiness, the itching, and the pain. If the sensitization occurs in the lungs and the respiratory mucosa, you're going to see bronchoconstriction, which narrows the airway, and increase in mucus, which further obstructs the airway. An example of this, like I said, is anaphylaxis. And your book talks about type 1 hypersensitivity because it's just the type of hypersensitivity, but anaphylaxis is a reaction in its own as well, if that makes sense. Anaphylaxis is considered a type 1 hypersensitivity, but because it is so severe, but it can happen very commonly nowadays, we talk about it separately. So anaphylaxis, let's look at that briefly. Severe life-threatening systemic hypersensitivity reaction, decreased blood pressure, airway obstruction, severe hypoxia, and the reason is because there's this huge amounts of chemical mediators. Remember that histamine that's released, and the mast cells do that very quickly, and it enters into the general circulation. That vasodilation causes severe decrease in blood pressure. Edema in the lungs causes constriction of the bronchi and obstructs the airflow. The lack of oxygen is either, it can be respiratory and or circulatory in origin. You very, very quickly see loss of consciousness. This is common things that happens, insect stings, latex, not as much as used to be because we kind of got latex free in the hospital. Penicillin, peanuts is our very most scary thing right now because kiddos sometimes don't know about allergies, and we it can be scary. Sometimes just touching someone with your hand after you've touched some of this food can cause a reaction. My son, who is now an adult, had an anaphylactic reaction to milk when he was in daycare years ago. And from the time they called me, and I was working maybe 4 blocks away. From the time I was called and the time I got to him, I left immediately and drove. He was already cyanotic and he was completely shutting down. So this happens in his allergies to milk, any kind of milk protein. So it's a very, very severe hypersensitivity reaction. Look at the other ones: cytotoxic, immune complex, cell mediated. We have to know what each of these are. What is an autoimmune disease? What does that even mean? Give an example or two. Different diseases that are considered autoimmune diseases. Chapter 8 is short and sweet when it comes to your final. What is psoriasis? What are the characteristics? Why do they have those characteristic issues with their skin? What causes the skin changes that occur with that disease? And then look to see there's a skin disease that is considered an autoimmune disease. What is that? What does it look like? What are the signs and symptoms of that? Chapter 9, how do fractures heal? Well, what do we have to do? Just by what you know from your kiddos that have broken bones or somebody that you know, we know that we have to immobilize them, right? If someone continues to use a limb that's got a fracture and they're either bearing weight on their leg or they're using their arm, it is not going to be able to heal. And this is why you need to know the patho, and that makes it all make sense, because a hematoma will form and that lays down the structure for granulation tissue to grow. And we already talked about granulation tissue. So that makes sense that we want to immobilize that and not move it, because then it's going to heal more quickly. If a bone doesn't get set, it may heal, but it may be really jacked up, right? You're not going to have that nice straight arm again. So look at the factors that delay healing. And then look at gout. What is it? What can cause an acute attack? Where would you see that? In what part of the body? Look at rheumatoid arthritis. What is it? What are the systemic effects? Remember, systemic versus local effects. What is muscular dystrophy? What are the characteristics of that? Rickets, a dislocation. All right, chapter 10, we're moving on along. Sickle cell anemia. What is it? And you know you're going to have the patho of it. What causes it? What are the complications and signs and symptoms? It's where usually some stress of some form causes these patients' red blood cells to change shape and they turn into a sickle shape, and then it leads to all kinds of problems. It causes so much pain. It causes obstruction. Take a look at it. It's very interesting. Look at pernicious anemia. You're going to have several questions over pernicious anemia. What is it? What causes it? What's missing in the body that contributes to this? There's tingling in the fingers and numbness. Why is that? What kind of deficiency is there? I think I already said that. What is the treatment and why do we treat it this way? I have another one here. It's on your blueprint. Just write it in here. Well, this is kind of going to be in a video. So on your blueprint, be sure and look at what are the 3 stages of hemostasis. Check that one out. All right, moving on to chapter 11. This is short and sweet. Yeah, not really, because you have to know so much, but multiple myeloma. What is the patho behind that? Which cells are involved? Lymphedema. What is the patho? Give some examples of diseases associated with this. Chapter 12, one of my very most favorite subjects is cardiac. So what you have to know is what is cardiac output, the textbook definition of it, all right? Understand it though, don't just memorize it. Understand what it means, what would make it increase, decrease, or what would help maintain cardiac output. I want you to think of the heart as nothing but a pump, just like a gas pump that's on your car. And if it's not working properly, there's things just like that happens in your body with your car. You're either going to flood or you're going to not get enough fuel to the engine to make it run. So think of the heart in a different way if you need to. I've got some mnemonics there as well. What is circulatory shock? Give an example, the patho. What happens in right-sided heart failure? What is an ACE inhibitor? What do they do? How is the heart regulated? What is cardiac reserve and preload? And know the difference between the pain and the symptoms behind myocardial infarction versus just an angina attack. All right, chapter 13, another favorite, and it's just because I've had to learn so much about it because my kiddo has asthma. So you guys know that if it's a topic that you're interested in or that you have someone that has it, you're going to be a little more diligent in finding out how it all works. So let's look up asthma. What's the patho behind an acute attack? There's multiple responses on this one. How would we treat it? So you kind of need to know the patho of what causes the airway obstruction in asthma. Look up adult respiratory distress syndrome. Again, the patho. It is also multiple responses. What is post-op atelectasis? Why would we be prone to this? And then what is hypoxia? We've had this before, so just kind of a refresher there. Ultimately, what could occur if someone is hypoxic? All right, chapter 14. Look up normal function of the left hemisphere. What does it control? Look at the sensory area versus the association area in particular. If the sensory area is damaged versus the association area in the left hemisphere. Look up increased intracranial pressure. You're going to see this a lot in a clinical setting. You're going to see it in your med-surg classes. What is it? How would you know that this was happening in your patient? What are those signs and symptoms? A brain abscess. How can that affect your heart? CVA, what is it first? Cerebral vascular accident. We call it a stroke. What are the common causes? What's the patho behind it? What are some warning signs? Everyone should know that, even if you're not a medical person, because just like time is muscle when you're talking about the heart and heart attack, we call stroke now a brain attack. And just like if your heart doesn't get enough blood to it, your brain doesn't get enough blood. Sometimes these stroke signs and symptoms never resolve, and you end up having neurological deficits for the rest of your life. So everybody should know the warning signs of a stroke. All right, chapter 15, detached retina. What is it? What are the complications of it? What is an ototoxic drug? What does ototoxic mean? Diabetes mellitus. What are the hallmark symptoms and why do they occur? You look at the 3 Ps, polydipsia, polyuria, polyphagia, but look at the patho to go, why are they thirsty? Why are they hungry? Look at it in that respect. Then look at ketoacidosis, the patho. What causes them to become unconscious? Look at hypo versus hyperglycemia. What are the signs and symptoms? What if they're unconscious? How do you assess them or treat them? Why does diabetes cause glucosuria? What is glucosuria? It is glucose in the urine. What is tetany? What causes it and why? All right, chapter 17. I think the rest of the chapters are pretty much self-sufficient. If you have celiac disease, what kind of diet do you need to be on? What type of signs and symptoms would you see? Same thing with pancreatitis. With a gastrectomy patient, they have limitations on their diet. What can happen if they eat too much or they eat a lot of carbs? Just kind of think about that. What happens if there's prolonged severe vomiting? what can occur with your patient and some of their electrolytes. All right, chapter 18, look up these terms: dysuria, azotemia, bacteremia, hematuria. What are the causes for chronic renal failure? What does renal insufficiency mean? What is hydronephrosis? Sometimes you just have to learn some of the prefixes. Hydro means water. So hydronephrosis means the kidneys have too much fluid on them and they're kind of larger because they're retaining fluid. What are the complications from this? The rest of the review is on your own. Good luck, and I'll see you for the final soon. Good luck, guys. Complete your blueprint and study.